Facial sculpting and buccal fat pad removal are two key portions of my medical practice. And a lot of people ask me a lot of questions, and this generates a lot of thought. And specifically, it seems that one trophy or one holy grail would be some sort of minimally invasive, if not non-invasive way to slenderize your face and reduce buccal fat pad volume, or at least the appearance of the buccal fat pads. So in previous videos, we've discussed things like the possibility of using radiofrequency tightening. We've discussed other things like that. I've even had patients who have had trials of Kybella and other injectable acids, which for the record, I don't recommend. A lot of commentary talks about mouth yoga exercises and things like mewing, things that I don't really know about and certainly don't have a place in the medical literature. And the answer may be a lot simpler than you think. Stay tuned to learn more. Hi, I'm Dr. Jonathan Zelken, board certified plastic surgeon in Newport Beach, California. Today I want to discuss a non-surgical way that's very effective that has the potential to either slenderize your face, reduce buccal fat, reduce the appearance of buccal fat, or any and all of the above, also to enhance the jawline. And although I can't say that this solution is tested in science, and I can't say that it will work for everybody, I will tell you that losing 5 to 10 pounds if you're overweight is a very effective solution.
You want me to lose weight?
No, I don't want.
We can't legally ask you to do that.
I might say tighten.
Tight.
Little.
It's really important to understand that different patients lose weight in different places, and a lot of people are incredibly thin, if not underweight, with fuller faces. And this could be because of skeletal phenomena or muscular overgrowth in the face. It could be because of any number of reasons where you lack definition. Thick skin is another reason. Ethnic origin and things like that all play a role. But what is it about some people that makes weight loss a very effective solution? I don't know the answer. So if you want definitive answers that apply to all of us, I guess you can stop watching now and save 5 minutes of your life.
Well, thanks for wasting my time tonight.
But for those of you who are interested and tend to lose weight in your face, I want to talk about the importance of losing just 5 pounds. And the preface of this conversation is that I have a friend in New York City who is studying a science called gorditology, which is weight loss. And he noticed when he visited me for the first time in about 10 years that I've personally gained about 50 pounds since my surgical training. And even though I still look fit and I feel well, and I'm still very active, I was on a trajectory of weight gain that was probably not going to be healthy in 10 years, especially factoring in my family history of cardiovascular disease. So he encouraged me to lose some weight, and I think by guiding me and providing advice and being a friend and giving me just, solid motivation, over the past month or so, I've lost about 5 pounds through diet, exercise, and more importantly, just regulation of my caloric intake, which is something that historically I didn't think about. Not everybody has 5 pounds to lose, and that's really important to notice. But if you are overweight, and by overweight I mean for men a BMI of 25 or above, and you do have room to recognize that perhaps you have too much caloric intake, try to lose 5 to 10 pounds. And I want to tell you what it did for me. Here's a 3D photograph of me about 5 pounds heavier, and here's a 3D photograph of me currently 5 pounds lighter. With these two photographs, although there's some distortion and there's some issue because of postural changes, it's pretty evident that I lose weight rapidly in my face. This is something that I've always known. So by losing 5 pounds, I immediately lost fat in the superficial fat compartments of my face, specifically the nasolabial folds. And these areas, in my opinion, seem to be one of the first places that my body seems to lose weight, as well as the appearance of buccal fat pad volume reduction. Although I can't prove that the actual volume of the buccal fat pads has gone down, you can see in this posterior oblique view that there seems to be some improvement in this convexity that has always bothered me. So if you can lose weight safely and keep it off, a series of photographs, or ideally 3D photographs, to volumetrically analyze your face can tell you whether or not you even need surgery at all. In an ideal world, we wouldn't need plastic surgeons because through lifestyle modification and behavior and diet, we can achieve our cosmetic goals pretty easily. Unfortunately, this is not the case for everybody. And like I said, a lot of people have obvious evidence of buccal fat pad either prolapse or overgrowth. And the reduction of that mass will improve the patient's facial contour significantly. In my case, no matter how much weight I lose, I still will have buccal fat pad prolapse. I would bet on that. However, it is pretty impressive to me in this quick initial 3D study, the impact that 5 pounds of weight loss alone had on my facial contour improvement. I hope this inspires some of you to potentially lose 5 to 10 pounds if you have that kind of weight to lose. And if you are at your ideal weight or don't have the ability to lose weight, I'm certainly here to discuss surgical options for enhancement, which are very, very satisfying to my patient population, and I'd love to discuss it with you more. If you want to see what happens with additional weight loss, perhaps I will lose more weight to get down under that magic number of BMI 25, and I will report accordingly. So turn your notifications on and be sure to subscribe. Thank you so much.